Hello, I'm Dr. Linda Stein Gold. I'm from Henry Ford Health System in Detroit, Michigan, and we have some exciting new systemic treatments for psoriasis. First, we have an oral agent, deucravacitinib, which was recently FDA approved. It's a TYK2 inhibitor that results in selective inhibition of the pathways that are important for psoriasis pathogenesis, including the IL-23 and 17 axis. This drug is highly specific for TYK2 and doesn't have the collateral effects on JAK1, 2, and 3. This contributes to the very good safety profile. Deucravacitinib was studied in phase 3 clinical trials with direct comparators of placebo and apremilast, and was statistically superior to both of these agents as a primary endpoint at week 16 and continued to show improvement at weeks 24. The PASI 75 for deucravacitinib at week 16 was about 59%, for apremilast about 40%, and placebo about 12%. And that improvement continued through week 24. And we also saw good clinical efficacy over the course of 2 years. The most common adverse events were nasopharyngitis, and most adverse events were similar to placebo. There is no black box warning or blood monitoring that's required other than for patients who have baseline liver disease. And it's recommended that you periodically evaluate triglycerides, and you do need a baseline TB test. Then we have another drug that's actually on the horizon, not yet FDA approved, and that's bimekizumab. This is the first and only biologic that actually selectively targets IL-17A and F, which are overexpressed in psoriasis. This agent actually shows unsurpassed efficacy in plaque psoriasis patients. In clinical trials, we saw significant efficacy actually as early as week 4 in terms of a PASI 75, with over 70% of patients achieving that benchmark in multiple clinical trials. We also have some head-to-head studies with bimekizumab. It was looked at and found to be superior to ustekinumab in terms of PASI 90 scores, 85% versus 49%. It was looked at as compared with adalimumab, 86% versus 47%, again for PASI 90, and secukinumab, 85% versus 74%. We also saw PASI 100s for bimekizumab, about 68% at 16 weeks. So the adverse events most commonly were an increase in candidal infections. So I think it's a really exciting time. We continue to see more and better improvements in our treatments. And I think it's a great time to have a new oral agent and a new biologic agent on the horizon. Thanks so much.